Great, thank you so much, and nice job with the standing ovations already. You guys are quick learners. I'd next like to introduce Captain Shary Jones. She's the Acting Regional Health Administrator for the Office of the Assistant Secretary for Health. She very impressive. She is a PharmD, MPH. She is a U.S. Public Health Service Commission Corps officer. Prior to joining Region 7 in 2014, she was the Deputy Regional Health Administrator, where she served as the Public Health Advisor in the National Vaccine Program. She completed an accredited specialty residency in geriatrics in Burlington, North Carolina, and the graduate of Howard University College of Pharmacy and Johns Hopkins Bloomberg School of Public Health. I would like to welcome Captain Jones.
Thank you. So look, right, at the end when y'all do y'all standing ovation, we're going to get a selfie so we can send it to my mama. I'm gonna tell her, like, look what happened. I'm not going to tell her that, you know, it was part of the conference. And so thank you. Thank you for the introduction. I thought y'all were going to read the bio. And so you can tell by my accent where I'm from. So you will hear that, and it definitely comes out when I read a lot. And so just wanted to quickly acknowledge the planning committee for all their hard work and preparation in putting this summit together. I'm pretty sure you all will be in for an awesome treat these next 2 days. So again, my name is Captain Shary Jones, and I'm the Acting Regional Health Administrator for Region 7. And I'm just going to quickly go over what OASH is, the Office of the Assistant Secretary for Health, highlight some childhood obesity in Region 7, and just address some of the programs that OASH has in our central office. The Office of the Assistant Secretary for Health's mission is to optimize the nation's investment in health and science to advance health equity and improve the health of all people. We have several core public health offices within OASH, including the Office of the Surgeon General, as well as 10 regional health offices across the nation. OASH is a staff division, and therefore we provide leadership and direction and policy management guidance to HHS as it pertains to public health prevention and population health. And here's just a fun map of where all of the 10 regional health offices are located, and of course Region 7 being in the middle with Missouri, Iowa, Nebraska, and Kansas. And in each of the regional offices, there's a regional representation that serves as resources and support various public health initiatives, such as the Office of HIV/AIDS and Infectious Disease Policy, Office of Minority Health, Office of Population Affairs, and the Office of Women's Health. And the Region 7 team is located in Kansas City, Missouri, and we're dedicated to assisting the coordination and collaboration of various public health initiatives. This could range from disseminating information, serving as speakers, convening partners and stakeholders, and providing technical assistance on all of our national efforts. And so you'll probably hear a lot of stats on childhood obesity in these next 2 days, but just wanted to quickly highlight childhood obesity from a regional perspective. In the U.S., the number of overweight children and adolescents has doubled in the last 2 to 3 decades. This slide shows a map of combined overweight and obese rates with children ages 10 to 17 in 2016. And then nationally, we have 31.2% of youth age range are overweight or obese. The highest rates are in the South, with the lowest rates either in the West or the Northeast. And the Midwest states of Region 7 are somewhat in the middle, which shows us there's just a slight need for improvement. And when examining the percentage of obese children by state, again in 2016, Region 7 collectively is below the national average, but there's still a lot of preventative work we could do in addressing obesity among children within our region. And as we discuss population health and move into a discussion about health equity, we have to note the disparities that exist in childhood obesity, with African Americans and Hispanics having higher rates of obesity than their white counterparts. And so comorbidities associated with obesity and being overweight are similar in children as in the adult population. The consequences of childhood obesity can be devastating to our children. In the pediatric population, elevated blood pressure, dyslipidemia, and higher prevalence of factors associated with insulin resistance and type 2 diabetes appear as frequent comorbidities in the overweight and obese population. And disturbingly, obesity in childhood, particularly in adolescence, is a key predictor for obesity in adulthood. Next, I'll highlight just a few of OASH initiatives to address childhood obesity. These strategies can be taken back to your communities and replicated to make a difference among our children. The Office of Adolescent Health has Think, Act, Grow, or TAG. It's a national call to action and provides a framework to improve adolescent health, to reduce risky behavior, and to promote engagement and healthy development among people in the United States. The game plan for engaging youth summarizes ideas for engaging adolescents in promoting their health and healthy development. And OAH, or Office of Adolescent Health, has identified a number of successful strategies for improving adolescent health throughout the country. Some may be helpful in addressing obesity. The President's Council on Sports, Fitness, and Nutrition engages, educates, and empowers all Americans to adopt a healthy lifestyle that includes regular physical activity and good nutrition. The Council has a number of programs and initiatives to help inspire one to be active, eat well, and be healthy. I Can Do It, You Can Do It is a health promotion program that partners with K-12 schools and school districts, colleges and universities, and community-based organizations to provide access and opportunities for children and adults with disabilities to be healthy and active. And that's just to name a few of the activities. So I appreciate you having me today. Welcome to the Childhood Obesity Summit, and I want to thank Children's Mercy Hospital, HRSA, and the Kaufman Center for making this event possible. I really hope you enjoy your time these next 2 days. Thank you. And I'm serious about the selfie. Thank you. I'm going to text it to him and be like, look, Mama, I'm famous. Thank you.